And there is another piece of legislation tucked inside the health care reform bill dealing with financial aid for college students.
When signed, it could make it easier for some students to afford college. And News 3's Marc Lovicott joins us with the story. Mark?
Andy and Susan, the legislation, in a way, takes out the middleman when it comes to administering financial aid, diverting money banks would otherwise get, and putting that money back into the financial aid system. Madison College freshman Shauna McLean aspires to be an astronomer. She's able to reach for the stars because of financial aid. She says it's her Pell Grant from the federal government that's keeping her in school.
If I know that I can receive this kind of help like every year, then, you know, why stop? I mean, I have no excuse to not go to school.
For 40 years, the federal government has been paying private banks to administer student loans. That's likely to change. Tucked inside the health care reform bill, legislation removing the middleman. Some say it's long overdue.
Some people have wondered for a long time why we need to involve banks in this at all. If the federal government is able to afford to make the loans directly to students, then why do we need to be giving extra money to banks, essentially?
In essence, the extra money goes back into the system to provide more funding for students. It's a simpler system as well, at a time when financial aid offices are overloaded with new applicants. For students like Shauna, the change is welcome.
It's letting me know that somebody actually cares and actually want to give us a reason to want to go to school.
Now, the banking industry earns an estimated billion dollars every year administering the federal student loan program. But experts telling us tonight, although the industry will have to make some cuts, some banks will minimize the loss by offering services to help students with their loan paperwork.
Lots of changes to come.
Yeah.
Marc Lovicott reporting. Mark, thank you very much.
Thanks, Mark.